And I just wondered if you could kind of talk a little bit about how we actually and what decisions you had to make and challenges that we encountered in putting together the right set of questions. How do you know how many to ask? How, do we make choices of, just the pros and cons of asking certain kinds of questions or not asking some, and especially considering the burden, the time it takes, and the limited amount of time we have with patients in clinical settings.
Gosh, there's so much there that we could talk on. I think number one, just finding someone like VNL and like you to partner with from a technological perspective was something that we've always wanted and thought that that was something that could augment what we're doing, but actually finding you was just sort of serendipitous. So I guess number one, the decision to pursue something together was easy for us in terms of what is created and how it's implemented in the practice. With that said, we have a patient advisory council, and they're also a part of learning what loneliness is and how to support patients while at the practice and outside the practice. And so they were involved in also learning what types of questions to be asking. And we were so grateful to VNL that you all were willing to take a leap of faith with us. The questions really came from the literature and what types of care we're delivering already at the clinic. The length of the customized assessment, I think, was something that was up for discussion. With that said, having a captured moment with someone, it seems like our patients are not turned off by the length of something that they're doing from home. Whereas everyone's tired of paperwork coming into the clinic. There's fatigue about this paper, that paper. But with that said, I think from home, when our providers help talk it through with patients and say, this is something that I'd really like you to take. Are you willing and able to do this? Whether it's online from home, or we're now talking about doing it from an interview type engagement with a patient prior to seeing the provider, patients seem receptive. And the ones who are ready and willing in terms of desire to make a change and acknowledge there's something here from a loneliness perspective, those are the ones that we're talking to right now.